Living up here in far Northern California, we have 2 mountain ranges, we have 2 volcanoes, we have lakes around here. It's really quite an idyllic location. But under that surface is the lack of economic opportunity. There's some people really struggling up here. We serve 1/3 of the population of Shasta County, around 60,000 patients. And over 90% of the people we're serving are below federal poverty. Our mission is like many community health centers around the country, and that really is about services, primary and preventive health services to underserved populations. To us, it's the larger public health mission. How do we improve the health of our community? I tell staff all the time when they consider coming here, you have to come with that sense of mission and purpose. It has to be sort of in your soul, and then you can express it through your work here.
Well, I come from a very simple background. What makes it very special here is that I connect with the people, and I'm glad to help all of those patients. The role of a facility like this is where we're just there for you, and you can come to us. We're here to help you, but come to us.
My favorite part of having this job in an underserved area is helping people. There are a lot of these patients, all they can go to is the emergency room.
And big breath in and out for me. Primary care it's what takes care of the patient as a whole. It's what keeps patients out of the hospital. It's what keeps people healthy. I can't tell you how many times I've seen a patient that says, you know what, I haven't seen a doctor in 25 years. And I take that as an opportunity to make a difference in that patient's life. How can I open the door here? And how can I keep that door open?
I don't know how we would be able to do it in this day and age without the National Health Service Corps in terms of helping to support our clinicians who are coming out of education with so much debt.
I want you to take your hand and point to where it hurts most.
Okay. Right here.
Let's have you lie back.
This program is so critical for the ability of underserved communities to bring people in. Without the National Health Service Corps, our shortage in primary care would be that much greater because students, medical students in particular, but nurse practitioners, physician assistants, they're all accumulating a lot of student debt.
It's nice to have that debt, that big, heavy number off your back. It just makes me feel like I'm more in control of what I want to do.
In the National Health Service Corps, it's an excellent program, and it's really helped us as a teaching health center because it's really attracted a group of people who really have that mission and that passion. Of course, our goal, starting our own training program here at our federally qualified health center, is that we can train them here and that they choose to stay here.
The Teaching Health Center program allows us to bring residents in who have that mission, purpose, and skills, learn in our environment, and knowing that when they get out, that they have the ability to have loan repayment that keeps them in our practice. They enter our workforce on a full-time basis, seeing our patients. It really is a beautiful thing when it all is tied together. We have benefited greatly, they have benefited greatly, really been a good marriage, and something that I hope will continue for a long time.